Hi, my name is Dr. Amin Javid with Beverly Hills Spine and Rehabilitation. Cervical issues account for, I would say, anywhere from 40 to 50% of my patient population that approach me every single week. Many different factors account for cervical or neck pain. Upper trapezius tightness, which has to do partly with stress, people who are anxious. Posture is probably the biggest contributor to this region pain, minus trauma. So if there's absence of trauma, it's very likely that this is a mechanical issue, possibly from overuse of dysfunctional movements, or just simply overuse of physical exertion. Sleeping position plays a big role in this. Biomechanically, there's some very important statistics of the neck that need to be examined. For example, for every 1 inch that your chin protrudes past your sternum, your neck and spine have to carry the equivalent of almost another head and a half. That's a pretty big number. When you realize how much these muscles have to work to grab onto your head to prevent us from falling over, because most of us are forward flex, you realize how many dysfunctions can actually happen in the neck. And then there cause very many secondary kind of compensatory results of this dysfunction. One of them is headaches. Most people don't relate headaches to neck pain. I think there's 13 different kinds of headaches. Cervicogenic headache is a very common form of headache that originates in the upper trapezius muscle and you know the mid to upper cervical spine. Trigger points of the upper trapezius from people with poor posture, stress, anxiety, like I mentioned before, causes spasms. It causes what's called myofascial trigger points in this muscle, and it refers pain up the back of the head, to the sides, and sometimes to here. These can all be addressed by addressing the cervical spine and doing some soft tissue work, myofascial trigger point work, pin and stretch, perhaps some manipulation, depends what's called for, but many of these issues originate in the cervical spine. So this is a very key anatomical part of our bodies that needs to be healthy.